Welcome and welcome back to my YouTube channel. It's your girl back again with a new video, and today we will be talking about breast cancer. If you want to know the basics of breast cancer, then this video is for you. So make sure you subscribe down below, press the notification bell for notifications of course, and feel free to share a comment down below, and don't forget to like this video. As you guys may or may not know, the month of October is specifically for breast cancer awareness, and therefore that means from the 1st to the 31st of October is breast cancer awareness month. And today being 31st of October, which is the last day of the month, I just thought I'll jump in and just give a few pointers on breast cancer. And before we move on, just as a side note, 13th of October, it's No Bras Day, where women across the world are encouraged to spend that day with no bras on. And this day was just created to enhance and create more awareness and sensitize more women across the globe about breast cancer. So next year, don't forget, if you didn't know that 13th of October was No Bra Day, now you know. Breast cancer is not a death sentence, and I insist, breast cancer is not a death sentence. And just a brief on global cancer statistics. You should know that breast cancer is the most common cancer in women. Out of all the cancers globally, breast cancer is the second most common cancer after lung cancer. So yes, this is definitely something we should be talking about in this video. We're gonna start off this discussion by talking about what are the common risk factors of breast cancer. Number one, it's just purely being a woman is risk factor enough for you to get breast cancer. However, that doesn't exclude men from getting breast cancer. Risk factor number two is genetic predisposition, whereby you have a first degree relative with breast cancer. That could be your mother, your first aunt. Number three, it's endocrine factors, which include hormone replacement therapy. Number four, we have some types of alcohol and diet, some types of oral contraceptives. All of these are just a few risk factors of breast cancer. And I know the question that comes to mind is, what should I be looking out for in terms of breast cancer? Like, is there something that I will notice on my breast that will make me think this may or may not be breast cancer? And yes, there are. So the first things, there'll be pain that is not caused by any sort of trauma or cyclical changes, that is towards your menses. Number two is any lumps on your breast, any nipple discharge, nipple retraction, dimpling, where the skin on your breast imitates that of the skin of an orange. There's also hyperpigmentation or discoloration of the skin around your breast. These five things are things that should always raise a red flag, and maybe or perhaps you should go see a doctor. Examination of the breast for breast cancer can take two forms. There is the self-breast examination and there is the clinical breast examination. The clinical breast examination basically is done by a doctor at a hospital. So that is not something we are going to be talking about. However, we are going to dwell much more on self-breast examination, because this is something that takes less than 3 minutes of your time, and you can do it every other day when you're taking a shower, and it's very easy. You should note that self-breast examination starts at the age of 20. The first step in self-breast examination is observation. Stand in front of a mirror and place your hands on your waist. So of course, if you know how your normal breast looks like, it's easy to detect any changes, any sudden change in size, any visible lumps, any retractions, any dimpling of your skin should now notify you that there may or may not be a problem with your breast. So after the observation and looking at yourself, now we move on to touching, which in other words is called palpation. So assuming that this wall was my bed, so I have to take my right hand, place it behind my bed, and then I'm going to touch my breast all around. So what you're gonna do is examine your breast in a circular motion, and you always have to start from outside, working towards the nipple. And remember, for an extensive breast exam, always make sure you start from the mid axillary line which basically is just an approximate area in between your armpit, all the way to your sternum, in between here, all the way from your clavicle to the ribs below your breast. So even as I go in this circular motion, I'll just be making sure I'm touching all these parts. And now, what are we looking for? So we are touching the breast to see if we can feel any lump, any part of your breast that feels that ain't right. So you feel for lumps, and in case you have been experiencing breast pain, so basically it's just this. And remember, you're lying on the bed on your back, and then you just have to palpate all round up to your nipple. Number 3, you're just gonna stand up or sit up like so, and then you're gonna lift your hand, one hand. So remember, when you do one activity for one breast, you have to go back and do it for the other breast. So then step number 3, lift your hand up. And in lifting your hand, what you're looking for? You're looking for any lumps under your armpit. So these are called lymph nodes. Sometimes they may be swollen or inflamed without even other breast symptoms. So this could also be an alarm for breast cancer, maybe something you should look for. So with your hand lifted, you're just going to touch your armpit and feel for any lump or any swollen lymph node. And if there is none, then we are good to go. So while we are still on this touchy part of the self breast examination, I'd like to add, during palpation, always use your 3 middle fingers. Always use the 3 fingers for your palpation. Yeah. So step number 4, use your thumb and your index finger to press your nipple. And don't inflict pain on yourself and come blame me on this video. No, the word is gently. Use your index finger, your thumb and your index finger to press lightly on your nipple. Once you press lightly, you will be in a position to see if there is any sort of discharge. There are only 4 easy steps of self breast examination. Takes less than 3 minutes of your time. You can do it on a daily, in the shower, when you're taking a bath, and that concludes the steps of self breast examination. If you're watching this video and you have a different opinion, different suggestion, perhaps you have something you may want to add on this video, make sure you let me know in the comment section down below. Hope that this video was helpful to you and you're going to start taking self breast examination from now onwards. And until next time, I will see you in my next video. Bye.